As I already have mentioned before, how you study pharmacology, it should be based on the exact mechanism, how each drugs are working. If you just simply try to memorize them, it really doesn't work on NCLEX. Okay? And one of the harder topics we have chosen for the day is why no beta blockers are given for patients with asthma. And I'm sure if you have done some preparation, you would have come across this question many times in your review. And in order to answer this question, first we need to understand some underlying background information, which is a little hard to understand when you hear the first time. But let's try to stay focused and try to understand why and how, so that you will be able to understand several different, I would say dozens of medication which you can relate into this topic you will see on your NCLEX and other nursing preparation exams. So let's try to look into the background information what we have here. Okay, so what happened, okay, as you can see, when there is SNS stimulation, that is sympathetic nervous system stimulation, what happened is stimulate the adrenal medulla. And when adrenal medulla gets stimulated, there is release of epinephrine and norepinephrine into the circulation. And how this epinephrine, norepinephrine acts in different parts of the body, it depends on what kind of receptors we have. And generally speaking, there are two types of receptors we talk, which include alpha and beta, and which are further categorized into alpha 1, alpha 2, and then beta 1, beta 2. So we need to know where each of these receptors are located and what is action these receptors have if they get stimulated. And whatever action it has with the stimulation or the adrenergic effect, and it is the opposite effect the blockers have. So now we're going to focus on these four receptors and its locations and its actions. So as I mentioned, they are alpha 1, alpha 2, beta 1, beta 2. So let us see where these receptors are located and how it works. So the first one, alpha 1, it is located in peripheral arteries and vein. Alpha 2, that is located in brain. Beta 1 is located in the heart. And whereas beta 2 has multiple locations which include arterial wall, bronchial wall, and uterine wall. Here we're going to focus only on the beta effect. So as I already told you, beta 1 is in the heart, beta 2 in the arterial wall, in the bronchial wall, and in the uterine wall. So what effect these beta 1 and beta 2 stimulation has? So let's look into that. And as I already told you, beta 1 is located in the heart. And let's see what its specific action is. So when there is beta 1 stimulation, it increases myocardial contractility, it increases the AV node conduction, and in effect it's going to increase the cardiac output. And when there is increase in cardiac output, you can understand it's going to improve the blood pressure. So that is a beta 1 adrenergic effect in the heart. Again, by different mechanism, it's going to increase the cardiac output and increase the blood pressure. So now let's look into the beta 2 stimulation effect. And as we already discussed, it has effect on multiple locations. So that includes the arterial wall, the bronchial wall, and the uterine wall. And let us see what its specific effect is. And let us see how beta 2 stimulation or beta 2 adrenergic effect affects this area. Okay. So in general, beta 2 stimulation has a smooth muscle relaxant effect in all these three locations. Again, in the arterial wall, in the bronchial wall, and in the uterine wall. So what will happen if there is beta 2 stimulation? So with the smooth muscle relaxant effect, the blood vessels can dilate. So it's going to reduce the blood pressure. It can dilate the bronchi, it's going to cause bronchodilation. And that's the reason why we use beta 2 adrenergics to treat asthma. And I'm sure the most common examples we use albuterol and terbutaline, right, to treat bronchial asthma. It's going to help for bronchodilation. And the third effect of beta 2 stimulation, as I told you, it has a smooth muscle relaxing effect in the uterus. That means it can relax the uterine wall, and that's why we use beta 2 adrenergics to stop premature labor. I mean, what we call a tocolytic effect. And the most classic drugs under the list, you might know terbutaline, which we know terbutaline is a bronchodilator. At the same time, for a woman in premature labor, it acts as a tocolytic, or it will stop the premature labor with the same effect. So far we were talking about the beta 2 adrenergic or the stimulating effect. So let us see how beta blocking works in the body. So first of all, beta blocking has the combined effect of beta 1 and beta 2. And recollect where beta 1 is located and beta 2 is located. We heard beta 1 is in the heart, beta 2 is in the bronchi, in the uterus, and in the arterial walls. So now if a patient go on a beta blocker, like what we call as the LOLs, right, the LOL drugs, if someone take those drugs, what happen? So it has effect in the heart, right? It's going to control the blood pressure. How? It's going to reduce the cardiac contractility, conductivity, heart rate, and it's going to reduce the cardiac output. So that's how it helps to control blood pressure for a patient with hypertension. But I told you, when it comes to beta blocker, it has a combined effect of beta 1 plus beta 2 in the rest of the body. So while this helps to control the cardiac output and control the blood pressure from the heart, it's going to have an effect on the rest of the body, particularly think about the bronchi. We heard beta stimulation has a most relaxant effect which can help for bronchodilation. Now, when it comes to beta blocker, it has the opposite effect. It's going to cause bronchospasm and can restrict the airway, can lead into asthma exacerbation. Now, it must be getting clear why beta blockers cannot be given for an asthma patient. Again, we heard while beta 2 adrenergic effect help for bronchodilation, beta blockers can cause bronchospasm and can worsen the asthma exacerbation. So does that mean a patient with asthma cannot get no beta blockers? Not exactly. And why? Because there are different generations of beta blockers. As you can see, there is first generation, second generation, and third generation. So when we say first generation, the other one with the effect in the heart and in the bronchi and the rest of the body at the same time. From this long list, most of these are first generation, which means when we give that to treat hypertension, which helps to control the cardiac contractility, conductivity, and reduce the output and reduce the blood pressure, is going to also act in the bronchi, which can cause bronchospasm. And that's how most of these drugs are. But when it goes to second generation, what happened? Its action is cardiac specific, means it's going to act only in the heart without having an effect in the bronchi or in the other parts of the body. And out of this long list of beta blockers, what you can see, the first two are typical example of the second generation beta blockers. So that means they act only in the heart, helps to control blood pressure without having an effect in the bronchi. And so they are safe to be given for asthma patients. And I hope this lesson was helpful for you to effectively understand why beta blockers are contraindicated in asthma patients, and particularly when it comes into the first generation beta blockers, the LOLs.